Never realized being a doctor doesn't come just with a degree. It also comes with a facet wherein you learn more about handling people, more about understanding their emotions, more about understanding the pain that they are going through, and helping them resolve the pain, maintaining their comfort zone. Contact any kind of injury, or you slip, or you just step over something, the chances of you having injury are higher.
Right.
Now, head, neck, face is technically well protected.
Correct.
But your teeth are not always protected. So whenever you fall down, at times, if a tooth is malaligned, the chances of you having an impact injury for your tooth is higher.
Wow.
So for such kind of sports, we would suggest visit your dentist on priority. Keep that tooth in milk or in your own saliva.
Oh.
Because that medium is going to keep the adjacent structure present on the tooth intact. But whenever you're involved in any kind of rigorous sport activity, the attrition increases. So attrition is a very scientific word. Attrition is vertical tooth loss of your tooth. So you lose teeth if you don't bother to take care of them.
Correct.
And eventually it leads to other problems. So we need to identify which tooth needs little extra protection.
Correct.
Because not every tooth is aligned as per textbook definition of alignment.
True, absolutely.
Right?
Yeah.
There is no such thing as perfection. Perfection is relatable.
Absolutely.
What you see is best is perfect for you. What I see is best is perfect for me. But not everything is perfect on this earth. It was also stated few years back.
Right.
It can also trigger migraine.
Really? To that
Malaligned
extent?
teeth. Yes.
Oh my God.
The study is still going on.
Right.
But malaligned teeth can trigger migraines.
Hello everyone, and thank you so much for tuning again into KRITVA Unplugged, your space for understanding about the field of sports on and off the field. I am Tanushree. I'm a sports storyteller and I'm the host for this podcast. Our guest for today is going to have such amazing shares about something that you may not have thought about when it comes to it associated with sport. When we think about any kind of injuries in sports, it's usually, muscle problems or fractures and shoulders and knees and, ankle problems or things like that. But one major place that we never think about and something that can affect the way that we live our life as adults is the teeth. So our guest for today is Dr. Amruta Tamhankar, who is going to share and, shed some light on how we can take care of our teeth and why it is important in the long run. Thank you so much, Amruta, for joining us on the KRITVA Unplugged podcast.
Thank you, Tanushree, for having me here.
Absolutely.
It's indeed a great pleasure to be here with you.
Absolutely. So let me jump right into our questions. This is a very interesting topic that we are, looking at speaking about today. So getting right down to it, you are a dentist and a cosmetologist, and you are also serving on the boards of various hospitals as a strategic leader in healthcare. So how has that journey been for you? Could you share a little bit about that?
It has been more than a journey, it has been my life.
Wow.
It initially started with an aim to be a doctor.
Okay.
Never realized being a doctor doesn't come just with a degree. It also comes with a facet wherein you learn more about handling people, more about understanding their emotions, more about understanding the pain that they are going through, and helping them resolve the pain, maintaining their comfort zone. So it has, many of them call this a journey, but I would say this was a developmental phase of my life from where, being an adult, I changed myself to be a doctor who would treat my patients in a way that they forgot they were visiting a clinic, they were visiting a place wherein their discomfort was relieved, and they went back with a smile. That has been a journey for me.
Absolutely. And I think the field that you have essentially picked up, dentistry is one thing which people are so scared about. Like, I speak from personal experience. Do not like visiting dentists, but it's always been very comfortable with you. So I understand, when you say that it has actually been more of a calling rather than just an occupation.
I would take that as a compliment. Thank you, Tanushree.
Yes.
But we have had many such patients who would walk on the opposite side of the road just because I had a dental clinic on
Oh my
one
God.
side of the road.
My God.
But after visiting our clinic, getting their treatments done,
Yeah.
getting acquainted to every procedure around, they realized that dentistry was more of a psychological scare than the actual pain or
Yeah.
discomfort that a patient would go through
True.
during the treatment.
Wonderful.
So, accepting the latest technologies, implementing the latest technologies in your routine day-to-day practice actually makes the difference. Initially, root canals were done in 3 to 4 sittings. Crowns or caps would take approximately a week's time. But now everything happens in an hour's time.
Wow.
So same day dentistry is the latest technology. The comfort that we are able to help our patient with also reduces their anxiety while visiting a dental clinic. So that is a drastic change, and I am so happy you accepted the
Right,
change
yeah.
and you were also comfortable getting it done at our place.
Absolutely. And so now this is a wonderful segue for me. In sports, it's about the quick decisions that happen, and so the kind of changes that have happened in dentistry also, like you have mentioned, I think I see a lot of that reflecting in sports as well. So personally, you have been a jockey, and
Yes.
you are very active in fitness field as well today, right?
True.
So how is it, or rather when is it that you realize the importance of highlighting the dental care for athletes or for sports people, and what are the kind of impacts that dental injuries could have on the life of a sports person?
Sport is a dynamic life.
True.
Right?
Yeah.
We are sitting here, we are sedentary. We might not get into any kind of an injury right now unless we fall down.
Correct.
Right? The chances of you having that kind of an impact in a sport, the probability goes much higher.
True.
Because the momentum at which you run, the momentum at which you play a sport, everything comes with little speed and momentum. So what happens is whenever you contact any kind of injury, or you slip, or you just step over something, the chances of you having injury are higher.
Right.
Now, head, neck, face is technically well protected.
Correct.
But your teeth are not always protected. So whenever you fall down, at times, if a tooth is malaligned, the chances of you having an impact injury for your tooth is higher.
Wow.
We never realize that. So every sport has an injury. Every contact sport has an injury, right? And it can be equally dental.
True. So, what are the kind of injuries now when we talk about dental injuries? So, what exactly are the kind of injuries that happen in sport?
So the kind of injuries, fractures, right? Similar can happen with your head, neck, face.
Oh,
Right? Even your nose. Because
right.
that is the most projected portion of your face.
Correct.
Right? Chipping, the way your bones fracture, similarly, your teeth fracture.
Oh, okay.
Right?
I did not know that.
Now, there can be internal minor fracture lines, which we call as graze lines.
Okay.
Over a period of time, these lines widen, these fracture lines widen, and then your tooth will chip. Your tooth is the second strongest structure available on earth.
Wow.
It is not that easy to fracture a tooth, but at the same time, it is brittle. It's like glass.
Right.
Right? The strength, inbound strength is there. So it will sustain the internal fracture lines which are developed during sports. But over a period of time, the tooth will fracture. So protecting your teeth during every sport is a mandate.
And so there is also, when people fall, so there could be chipping of the tooth, or
Yes.
it could actually just entirely also come loose.
That is known as avulsion.
Okay.
So the entire tooth pops out. Right? That is known as avulsion.
Okay.
It happens when there is a sudden huge impact, which does not fracture the adjacent bone, but the tooth loosens and it comes out. So for such kind of sports, we would suggest visit your dentist on priority. Keep that tooth in milk or in your own saliva.
Oh.
Because that medium is going to keep the adjacent structure present on the tooth intact. Do not scrub the tooth under water and clean it, because the tissue which is present on the tooth can help us replace the same tooth in the oral cavity.
Wow.
And the chances of your body accepting the tooth are higher.
Oh, wow.
So we can actually replace an avul's tooth. We need not extract and replace.
Wow. Oh, that is very
So we would
interesting.
suggest you, if at any given point of time you have a dental injury where there is avulsion or the tooth falls out,
Yeah.
get it to the clinic as early as possible in less than 68 minutes.
Wow.
We
That is
would be
actually-
able to see.
That is very interesting. So, can you share what are the kind of sports which have a high risk for injury?
So, what we call sport today is also a day-to-day activity for few individuals.
True.
Like primarily visiting a gym. People who go to gym every day, it is a sport activity. Athletes who run, jog, that is again a sport activity. HIIT exercise wherein your heart rate goes up. Any kind of heavy cardio activity is a sport activity.
Correct.
Contact sports we all are aware of, like for example boxing, rugby. Other games like running, marathon, and like Zumba or deadlifts and football, tennis. These activities also are considered wherein you would require a little bit of tooth protection.
Oh, that is interesting. It's actually quite interesting. I did not know about the you can replace the same tooth. That is wow. So that is interesting. So it's not only contact sport that essentially has dental injuries. Any sport could like the athletes could be they could have these kind of dental injuries, right?
Yes.
Okay.
So dental injuries are not just fracture of the tooth fragment or avulsion of your tooth.
Okay.
It is also attrition of your tooth when you clench your jaw.
Oh.
Right? This is clenching of your jaw.
Yeah.
That also has an impact.
Oh.
So that is also a tooth injury.
So then even like when people go riding or they have these F1 races or go-karting, so that is also something. So anything related to speed also, skating for that matter, I think the people who are into that is also where you could clench your teeth.
True.
When you need that burst of energy.
When you're putting your cross steps while taking a turn on the rink race.
Yeah.
Trust me, you need precision. Wherever
Correct.
you need precision, you need extra attention and concentration.
Right.
What do you do when you are completely engrossed in something? You clench,
You do.
right?
And it's so subconscious, you don't even realize
it happens subconsciously because you need the strength. You need the entire strength.
Right.
So that is where it comes in picture that protecting your teeth is equally important.
Correct.
It is not just about using a teeth guard or something else that you do.
Yeah.
It is the priority here is to protect yourself and the tooth.
Correct.
That is what our priority.
Which is actually what the thing that you mentioned is what my next question is about is how is it that the athletes can then protect their teeth? Like what is one of the easiest ways for them to do this?
The easiest way to protect your teeth is by having a teeth guard.
Oh.
A teeth guard is something of a silicone material which stays on your upper jaw and on your lower jaw.
Okay.
There are two separate entities. Separate for your upper jaw, separate for your lower jaw.
Okay.
Your upper jaw never moves, but your lower jaw is in a dynamic state, right? So we need something which will move or be static according to your jaw positions. Right? So if you have individual teeth guard, they move individually, the way your jaw moves, right? And that is where your individual jaw protection happens here.
Wow.
So a teeth guard is something that every sport individual or a sportman should have.
Which actually brings me to my next question is, so what happens or what are the long-term impacts of not using teeth guard? See, right now, I don't think anybody has, actually even had this kind of a conversation that a sportsman needs to actively protect their teeth as well.
True.
So why is it so important? What is the kind of impact that will, happen in the long run if they don't protect their teeth?
So the impact is not just associated with sport.
Okay.
Right? Ever since the age, say you are 6, you have permanent teeth in your oral jaw.
Right.
So since then we keep on chewing. Since then we eat anything and everything that is provided to us, right? So there is a little wear and tear which happens with your tooth with age, right? You must have seen elderlies, they have little flattened tooth.
True.
Whereas younger ones have sharp teeth.
True.
Right?
True.
The reason is that is attrition.
Okay. Okay.
It happens with every individual. But whenever you're involved in any kind of rigorous sport activity, the attrition increases. So attrition is a very scientific word. Attrition is vertical tooth loss of your tooth. Right?
Okay.
So your tooth is M-shaped. With time, because of grinding, it loses the cusp. This is the cusp of your molar. Right? You start losing it and then they start becoming flat.
Right.
Right? This is attrition. Now, it goes, or the probability of an attreated tooth is higher if you indulge yourself into any kind of rigorous sport activity.
Okay.
Because you clench your teeth again. Clenching causes vertical tooth loss. So here, with vertical tooth loss, are issues like, it's simple. You lose the sharpness of your tooth, right? You try slicing a tomato with a blunt knife. Have you tried doing that once? At least, I'm sure everyone has done it, right?
Yes.
What happens? You're never able to precisely cut it.
Correct.
Right? So there will be just spurts of tomato around.
Yeah, true.
Same happens with your tooth.
Okay.
Right? Same happens with the food that you're eating. You're never able to chew your food properly. If you don't chew it properly, your stomach cannot digest it. If it is undigested, assimilation or absorption of your food in your gut changes. Eventually changes your nutrition cycle.
Wow.
So this is where we have to understand attrition is not just tooth loss. It is also a health loss for you. And health loss equates to an exponential decay in your life cycle.
Correct.
So a teeth guard is important here because attrition is not just associated with sport.
Right.
It is associated with every individual. The chances of attrition increase whenever you have a rigorous sport activity.
Right. Got it.
So an average individual will have an attrition at this rate. So a sportsman will have it at this rate. Anyone who's into deadlifts, they lift more than 50-60 kgs, right? Which is more than 20-30% of their body weight. Right? Whenever you lift your weight, you're taught not to clench your teeth. But at times, it happens that you have to clench your teeth to get this muscle strength.
True.
Right? And that is where when you grind, you tend to lose your tooth in a vertical fashion.
Wow.
That is what attrition is.
Crazy. So the kind of domino effect of, us not taking care of our teeth as sports people, like problems with your stomach and your digestive tract, like cannot even imagine that, such a small thing or what seems like a small thing right now can cause a lifelong problem if you do not give it the importance that it actually has in today's times.
True.
Wow, that is amazing. So, can you now share with me what is the difference between like a store-bought, teeth guard and something that is custom made for an athlete?
So, for a custom made, we say in Sanskrit, na bhuto na bhavishyati.
Okay.
It means there was no one like you before and there would be no one like you ever again. Right? When you as an individual are so special, you specialize everything for yourself. Right from your shoes to your dinner plates, to your clothes, to your accessories, to your bed sheets, to your bedroom accessories. Everything is specialized for you, right?
Correct.
Why should your teeth guard not be specially designed for you? Right? So you have 32 teeth. The right side of your jaw is not exactly 100% identical to the left side of your jaw. Right? So there are little deviations on each side. We have to make sure that the teeth guard aligns to those deviations. Right?
Correct.
So this will help you protect your teeth in a better way. A non-customized one is universal.
True.
Right? Universal products never fit you perfectly the way tailor-made ones are for you. So I would always recommend get a customized teeth guard for you. It will protect every tooth the way it is to be protected.
Correct.
And not just a universal one which says we can protect. The word can and must.
Yeah. is
they
the
have a difference.
Absolutely.
And we have to choose must over can.
I so understand this difference. So essentially, I've never used teeth guard, but so I used to skate, and like I remember the shoes that you mentioned. So we used to have shoes of different brands, and our coach has always told us to go with the slightly better one, in the sense that because that particular shoe had heat molding inside.
Right.
So once we had put our foot in, it took the shape of our foot.
True.
And because of that, there was no movement inside of the shoe. So I understand when you say that, like a shoe can be good for anyone. You get your size and it'll fit. But getting that custom fit, it changes the way that you perform, on the field. So
to just be precise with this,
yeah,
if we both visit a store to buy a shoe,
right,
same brand, same shoe, same size, one fits better for me, and maybe it doesn't fit the same way for you.
True.
Right?
Yeah.
So you not having, more than you not having your teeth and your teeth guard, they have to work in sync.
Correct.
If your teeth guard doesn't fit snugly, and if it does not protect every nook and corner of your tooth, the teeth guard is not doing the job that it is supposed to do.
True. The conversation that we were having just before the shoot, that was a very interesting statistic that you had shared, that if you do not have custom made teeth guard, they act as a distraction, and whereas that will impact your performance to up to 10% either ways. Okay?
Yes.
So can you just share a little more on that thought?
Let's consider we have a wedding to attend, right? We dress ourselves up. There is a sari, there's a bag, there are bangles, there is a flowing pallu which we carry.
Yeah.
How often does it happen that we keep on adjusting some or the other thing?
Yeah.
Right?
True.
So the same happens when you have a continuously moving structure in your oral cavity. Right? A non-customized teeth guard will keep on moving in your oral cavity because it does not snugly fit you. Right? If it doesn't fit you well, you need to give little bit of an attention to make sure that it stays in place.
Correct.
That is what is going to deviate your mind from the goal of you enjoying your game. Right? So that deviation, for few it might cost the winning table. For few it might cost, oh, I just lost that shot because of this. Right? So losing is one point here.
Correct.
Secondly, customized ones make you feel as if it is a part of your body.
Nice.
You barely have to put an effort to make it stay in place. So we suggest always go for customized teeth guard.
I'm also enjoying the examples that you're giving because they're very relatable to day-to-day life. And I can actually imagine that if all the things are properly in place, like for the wedding example that you gave, you don't even realize that you are carrying so many things.
True.
But if you're not, and then you are distracted, you're not in the right mood, and all of that changes. So I love the parallels that you have. That's wonderful.
Thank you.
So Amruta, you have worked and you've helped quite a few athletes after they've had dental injuries. So could you share a little more about that experience?
So we start with contact sport initially.
Right.
There was a boxer. And during boxing, he lost 3 to 4 teeth. But it was a huge punch which he got. And then after a while, we realized that we extracted the ones which were fractured. And we had to wait till the time his wounds heal.
Correct.
And then we had plans of replacing those missing teeth. And over a period that took not more than a month. In a month's time, he visited a gastroenterologist for acid reflux, indigestion of food, constipation, loose motions. And even the gastroenterologist was thinking, what went wrong suddenly with him? That he's not in a perfect health condition. His food habits are clean. He exercises regularly, everything. And then he mentioned, I lost few of my teeth. Gastroenterologist requested him to visit back to clinic. On priority, go fix your missing teeth. You're not able to chew your food properly and swallow it.
Wow.
That is the reason why your gastrointestinal system has gone on toss.
Oh my God. And in 1 month?
In a month, because athletes have a very high protein kind of diet. Right? So chicken, if you don't chew and swallow, it will have different effects on your body. Because it is not easy for anybody to digest unchewed chicken.
Wow.
So this is where they came back to us. We replaced his missing teeth. And it took around 2 months to stabilize the entire gastrointestinal behavior. By around max 2 months it took him.
Wow.
And then he got back to his normal health.
Wow.
So you lose teeth if you don't bother to take care of them. And eventually it leads to other problems.
And long-term impact, essentially, of this, because once
this was very acute.
Yeah.
Because the main problem arose when we realized where he had an upper tooth, he did not have a lower one. And
so
where he had a lower one, he did not have the upper tooth. So he was chewing just from one side.
Right.
And he was not able to chew his food bilaterally.
Correct.
So majority of the food morsel which he did chew on was swallowed in a coarse way.
Wow.
That was one live example we had.
Correct.
And even today I'm able to relate to it,
Right.
that every individual should replace his or her missing teeth.
Wow. Amazing. So this was about the contact sport, and you also mentioned there are other individual sports.
So there was one child from your skating.
my sport, yes.
Yes, the one which you love.
Yeah.
So, congratulations, you have been a wonderful player.
Yes, thank you.
So she was also skating. It was a practice session.
Okay.
And she lost her control. And then she fell down. Her front 2 teeth, they cracked.
Oh.
And it was just a horizontal fracture line, which was visible.
Okay.
So her parents were like, right now she has her game coming up.
Right.
So we just fix the initial part of it. We fix the rest later.
Okay.
In another month's time, there was internal bleeding which happened inside the tooth.
Oh my God.
And it was not just those front 2 teeth, it was the 4 upper teeth and the 4 lower teeth.
Wow.
And her 8 teeth, they started to look grayish in color.
Oh my God.
Initially they looked pink, then they looked gray. There was internal bleeding. So, आपल्याला हाताला पायाला लागल्यावर कसं काळं निळं होतं, तसा दात काळा निळा होतो.
I am learning so much today. Wow. Okay.
So, and that is where we requested them that we need to address this situation on priority, because if it leads to any further infections, we might lose 1 or 2 teeth. And then we performed the treatments, we fixed her problem. Though it was after her final game, we did fix it, and we requested her to wear a teeth guard. So we do not land up into similar kind of issue.
Correct.
And to my surprise, after a few months during the practice session, she fell down again. But this time, because of teeth guard, nothing happened to her teeth.
Wow, wonderful.
So that was another live example which we give to our athletic clients that this is how you need to protect your teeth.
Yeah.
End of the day, prevention is better than treatment.
Absolutely. No, and I am quite enjoying the fact that we are discussing the severity of what could happen, because we might feel like the teeth are such tiny parts of our body, but the kind of impact that could happen, did not even realize that you could lose your teeth just because of a fall in this manner. So wow, that is actually interesting. So we are at a stage in our country where a lot of athletes are representing our country. So I know that there are different protocols and maybe stricter protocols and mandates that are there for international academies, or the kind of training that happens in terms of the protective gear and things like that. So where do you think we as India stand right now when it comes to the athlete's health and especially the dental care?
India has been a developing economy.
True.
For a while.
Correct.
Right? There was a time when any individual who had to select a career had to choose being a doctor, engineer.
True,
right?
so true.
Right?
Yes.
So sport never had a priority
Yeah.
In the initial phases
Correct.
of majority of them would face that, right? So now we are in a phase wherein parents expect their child to have to accept one or the other sport and make it a part of your daily routine.
True.
Right?
Yeah.
Because health is actually healthy if you have a sport in your life. It helps.
So agree.
It is a recreational world for you.
Yeah.
You have a new set of friends there.
Yeah.
End of the day, the exercise which you indulge in also helps you improve your cardio as well as muscular health
Correct,
and
correct.
overall well-being. Right?
Absolutely.
So now, initially, we never had the option of investing in a sport gear.
True.
Right?
Right.
Now your child is playing, many of them opt for tennis, right? The racket is expensive. You need new set of balls, maybe weekly or every 15 days, right? For swimming, you need swimming glasses,
True.
right? A good swimming outfit, right? So everything requires some other kind of investment.
True. True.
But we still feel outside India, before accepting a sport, what you accept for yourself is protection while indulging in that sport activity.
True. Right.
Right? But in India, it is primarily you accept the sport activity and then we think of accepting a protective gear while indulging in that sport activity. We slightly need to reverse that.
Actually.
Because if you are safe, the sport in you continues.
Oh, wow. Wow. I love that perspective.
Right?
Nice.
If you do not protect yourself, over a period of time, maybe तुम्ही एकदा पडलात, दोनदा पडलात, तीनदा पडलात, चौथ्यांदा आई वडील घाबरतात.
खरे खरे.
राईट? उद्या तुला काही झालं तर आम्ही काय करू?
करेक्ट.
राईट? सो हे स्टेटमेंट प्रत्येकाच्या आईकडनं येणार आहे, प्रत्येकाच्या वडिलांकडनं येणार आहे. सो व्हॉट वी नीड टू एक्सेप्ट हिअर इज लेट युअर चाइल्ड प्ले. Make sure you give them the protective gear. Today your child is cycling for the first time. You give them a knee brace.
Yeah.
You give them an elbow brace, right?
Correct,
You give them a jacket which will protect them from bruises, right? Similarly, for other games, there are n number of protective gears which you have.
Right.
Every sport has a different protective sport gear, right? Accept it primarily and then play the game. So this small change can help you be in that sport for a longer time. That
And
is
be a
what
better performer
outside
also.
India happens.
True. Right.
The same needs to be accepted by every sport academy as a primary rule
Correct.
while introducing a sport in any child's life.
Wonderful.
If you introduce it properly, the child is going to follow that way. Because we follow our gurus, right?
Correct.
If our teacher says this is how A looks,
Correct.
we say this is how A looks, right? So if your sport trainer is going to teach you that way, you're going to follow it to the T.
Absolutely.
Because we all love our teachers, we all believe in our teachers, right? Similarly, our sport teachers, if they teach us this way, first protect yourself. Then you can play the game for a longer period of time. That is what is needed.
Wonderful. So I think protective gear should also be a part of your kit from day one rather than waiting. So how is it, in what way can the sport academies bring about this awareness to their athletes, to their students, and in fact even to the sports parents? Because like you very rightly said, the whole protective angle is going to come first from the parent.
Yes.
So how is it that these academies can build an awareness about the different kind of protective gear that an athlete would require?
These days, sports academies, they have in-house nutritionist, they have in-house physiotherapist, they have in-house other doctors which are needed, like a sports psychologist.
True.
Right? Because every individual needs them, right? So if they also include other doctors which will help them get in a mode wherein this is protection for you. That protection comes with in-house or empaneled doctors associated with the game.
Right. Wow.
Right?
Okay.
So if you have seen all cricket matches, they have a physio who is a part of it. Any football match, they have a physio with them.
True,
Right?
absolutely.
They have a nutritionist with them.
Yeah.
Everything is monitored. We are speaking about bigger games.
True,
Let's come
of
down
course.
to a smaller level or a town level kind of a game, right? Let's say today I go to, I'm a part of Deccan Gymkhana. So whenever I go there, if I have a physiotherapist there, while playing any game, if I have any kind of muscle injury or any kind of injury, my physio helps me relieve it on priority.
Immediately and then and there
Immediately,
itself. Yeah.
right? So if they are in-house or empaneled, the way the child is taught to protect himself or herself during a sport activity
That changes.
is aligned in a way
Right.
that the child protects himself or herself.
Correct. Wow, that's very interesting. So, Amruta, a lot of people who also watch the podcast, they are sports parents. Would you happen to have any words of advice, for the sports parents that are listening in?
So if you are a sport parent, we would request you to come down to my clinic, All Care Dental Clinic. We have a look at your child's teeth and we advise you what kind of dental protection you need. It is not the same for everyone. If your child is playing tennis, it is different for him or her. If your child is playing football, it is different for him or her. If your child is a cross-country runner, it is different for them. So every sport has a different kind of a teeth guard. If your child is into weightlifting, it is different.
Wow.
So we need to identify
What
which
it is.
tooth needs little extra protection.
Correct.
Because not every tooth is aligned as per textbook definition of alignment.
True, absolutely.
Right?
Yeah.
There is no such thing as perfection. Perfection is relatable.
Absolutely.
What you see is best is perfect for you. What I see is best is perfect for me. But not everything is perfect on this earth. The earth itself is not perfect.
Absolutely. True.
Right?
Yes.
So, similarly, your teeth are also not perfectly aligned every time. We also need to understand which is a vulnerable tooth. Right? We need to extra protect that vulnerable tooth. So for that tooth, we have to take little extra care. We have to modify the teeth guard in such a way that the tooth stays intact.
So you also take these awareness sessions in different schools and in corporates, all of such places, right?
Yes.
So would you also be open to taking up such sessions for different sporting academies to kind of give
course.
awareness
Of course.
to the parents? That is wonderful. Is there a difference in the way that you would test or check the child's teeth? In school, there is a certain level of kind of checking that happens. Would that really be different if you're looking at it from a sporting point of view, or is that really the same?
It will differ completely.
Is it?
Yes.
Wow.
Because in school, we help them in a preventive way.
Okay.
Right?
Okay.
The school screening is more of making the parent aware what are the dental problems your child has. Maybe they might have a cavity. Maybe they might have malaligned teeth. Maybe the brushing is not perfect. Maybe your child needs little extra attention towards getting his or her fillings done. Right? So it is more from preventive perspective.
And more hygiene parameters.
More of hygiene parameters.
Right.
But when it comes to sports academy checkup camps, they are completely different.
Wow.
So during the sport academy, what we do is we check the intensity of they clenching their teeth during the workout.
Wow.
Every intensity needs different kind of an attention. What is the alignment of the jaw? Maybe the right side jaw is clenching harder.
Wow.
Or they are trying to grip their jaw differently. Right? So there are different ways how you close your jaw because your lower jaw moves.
Right.
So you can just pull it in the front, pull it in the back, move it to the right, move it to the left. Right?
Wow. Nice.
So we have to understand because every individual has different way of handling things.
Right.
We have to understand that and then address accordingly.
Right.
It is not something what you might need is the same that I might need.
Correct.
I have to understand because we are two different individuals.
Absolutely.
So that is how it needs to be addressed.
Correct. That is fantastic.
Assessment varies.
Wonderful. And like you very rightly said, the way that or the basic things that you would look for from an athlete's perspective is very different to what you would look at as a regular child's, kind of
Yes.
taking care of it. So although it is happening, dental camps are kind of happening in schools, it is still important for the sporting academies to get these kind of checkups or these kind of camps done for their kids as well. So that's just a value addition for them.
More than just saying the value addition part of it, it is something that should be a basic part of the sportsman's life, right?
Absolutely.
Because from sports academy perspective, you're concentrating on the child's game, improvement in the game,
Correct.
right?
Yeah.
Whereas in schools, the perspective is academic and cultural development, right? Here it is physical development.
And even this, like the smallest of things, taking care of this is going to impact the child's development or the child's performance when it comes to sports, the kind of
Yes.
assessment that you're going to do.
Yes.
That is superb. So guys, I have been having wonderful conversations with Dr. Amruta. I am learning a lot of things here today. If you are also learning something new from whatever she's been sharing, put that in the comments below. What is it that you have found very fascinating? What is it that you learned something for the very first time today here on this podcast? So now, Amruta, we move to our second segment. This is called as the failure feeling. Okay. Failure, yes. So
The scariest part people feel to speak about.
Exactly. That is the whole point, that failure is something which is so natural in our day-to-day life, that something or the other is going to happen, and it's not that, the trajectory is always upward.
True.
So what we believe is that as a athlete, or the kind of mindset that you build when you are in sports, you learn to handle failure in a very different manner. So that is something that I would love to ask you as well. So what has been a failure feeling, that you've had in your life, and how is it that, you've overcome that?
So dentistry has been my passion for a very long time.
Right.
It was never by option that I chose dentistry. It was always my choice to be a dentist.
Right.
But like you rightly said, the graph is never exponential high. It is always a pendulum, right? Ups and downs, ups and downs, ups and downs.
Correct.
So I did have my own ups and downs.
Right.
But I would never term them to be my failure.
Okay.
I would term them to be, many of them say it as a learning curve.
100%.
But failure is a word which hits harder.
Right. I can
So
understand.
a learning curve sounds better.
Yeah.
It was not exactly a failure for me. It was more of a monotonous work which I had made for myself.
Right.
Right?
Right.
Dentistry, for every dentist, it is like basic filling, scaling, root canals, caps and bridges, dentures, nowadays implants. So all these things were there. Then after 15 years doing the same thing again and again, it becomes monotonous.
True.
That monotonous lifestyle in dentistry made me go a little stagnant.
Oh. Right.
And then comes a phase wherein there is self-realization. What am I doing? I did start this clinic with a perception that it's my passion.
True.
Today, part by part, I have lost the passion part of it.
Right.
It has become a daily routine. आपण म्हणतो ना गिरणी.
Correct. Correct.
So that is what it made me feel like.
Right.
And then it was like सकाळी उठून आवरून क्लिनिकला जायचंय, काम करायचंय, घरी यायचंय, जेवायचंय, परत क्लिनिकला जायचंय. But then I lost the fun element in it.
Yeah, the spark of
The
that
spark
entire
of
thing,
it.
Yeah.
And then I was just discussing it with my husband Siddharth, and then he said, it's not the monotonous lifestyle that has made it boring. It is non-acceptance of change.
Wow. Interesting.
And that is where we all have heard this term, change is the only constant.
Very
right?
true.
But at that phase, he made me realize there is no change that you have in your clinic. You have made it so much perfect square that you don't have a scope of moving out of it.
Right. So there's no fluidity. It was
No
structured.
fluid.
There
It
was
was
beautiful.
well structured. So was my clinic well aligned? Yes.
Yeah.
Everything was perfect, right from start to end. Did my patients complain? No. But I was
Not growing.
more than not growing. I was feeling stagnant.
Right.
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 And then he said, change. I'm like, what should I change? I have latest technology. I have good infrastructure, armamentarium. What more could I change? He's like, technology. And that is where it made me think. And then was COVID.
Okay.
So during COVID, I got little extra time for myself to think, what is it that I need to change?
Right.
And that is where technology stepped into my life.
Wow. Nice.
We introduced a scanner in the clinic. It is a 3-shape scanner. So initially you must have seen people make the impressions of upper and lower jaws, right? Now we scan the jaw from inside.
Oh.
It is a digital way of making impressions.
Right.
We introduced that technology. That was one change which made me happy.
Nice.
Then came single day root canals. Initially, root canals took 2 to 3 appointments. Now my root canals are done in just 1 hour.
Wow.
So 1 hour, not exactly 1 hour, but little plus minus.
Yeah.
So that was another change which I did. So that made me learn new technology.
Nice.
How is it that you have to get perfection while performing a root canal in 1 hour?
Wow.
Right?
Nice.
After that came another change of technology is in-house lab. We started making the crowns in-house.
Nice.
So we had to design. So my third-party liability or third-party dependency was reduced.
Correct.
Introducing technology also made me happy. Now I can make caps and I can deliver them the same day. Right? Because the impressions are digital. The crown manufacturing system is also digital. They work hand in hand. Now, initially what I took like approximately 5 days to complete a root canal and a crown, I'm able to complete that work in a day.
Wow. Wow. 1/5. That's
1/5 of the time.
Wow.
So it is not the time that gave me a happy momentum.
Correct.
It was the change in technology, learning something new.
Right.
Upskilling is the word these days.
Correct.
So that upskilling helped me.
Wonderful.
Then later we introduced AI. Then aligners. So we kept on adding newer technology to our clinic. And that is where change was the only constant in my life, which helped me out of that stagnancy.
Beautiful.
I would request everyone, accept the change.
Yeah.
That will change you to be a better person tomorrow.
Absolutely. Wonderful. Wow. That is actually quite interesting. So guys, if you are enjoying the conversation, don't forget to like, subscribe, and of course, share it with any sport parent that you know. Also share it with any sport academy or coaches that you may know who need to have this kind of information that we're discussing here today. So Amruta, we now come to the third and the last segment of our podcast. This is something that we call as the community asks.
Okay.
So the KRITVA community that we are building, so the online and the offline on-ground community, they have sent in a few questions for us, which I would like to ask you, as an expert.
Awaiting.
So the first question that we have is, are aligners or teeth guards safe for athletes who have to train daily?
Yes, of course.
Okay.
It's a part of your life. It's not something that you use it as per convenience. It is something, for example, brushing your teeth twice a day.
Right.
Is a hygiene, daily hygiene.
Correct.
You never change it.
Correct.
Right? Similarly, teeth guard is something which is a part of your daily routine workouts.
Absolutely.
Be it a daily workout or daily training. It is
so the same way, like if for skating you're wearing your speed suit, the same way you have to wear, or swimming costume like you mentioned, if that is a basic protocol of the sport. So teeth guards are like that. So daily it is absolutely fine. Wow, nice.
You got it. Perfect.
Yeah. Can misaligned teeth lead to headaches or jaw pain for the athletes?
At times, yes. Because the way you chew your food, the way you clench your jaw can trigger headaches.
Pain. Oh, wow. Okay. This is an interesting one.
It was also stated few years back.
Right.
It can also trigger migraine.
Really? To that
Malaligned
extent?
teeth. Yes.
Oh my God.
The study is still going on.
Right.
But malaligned teeth can trigger migraines.
Wow. Nice. So if they are having constant headaches or frequent headaches, maybe they also need to just go and check their teeth. That is also a very important thing.
The psychologist decides that, or their neurophysician decides that.
Wow. Nice. So this is an interesting one. As a sports parent, what are some early signs that my child's teeth are vulnerable?
So the early signs are when the child is shedding deciduous teeth and the permanent teeth are erupting.
मतलब milk teeth जा रहे हैं and you're getting a permanent
milk
teeth.
teeth.
Okay,
दुधाचे दात जात आहेत आणि पक्के दात येत आहेत. त्या फेज मध्ये जबडा लहान आहे पण तो दात ॲडल्ट साईज आहे. तो तेवढ्याशा जागेत मावणार नाहीये. सो तो दात थोडासा बाहेरच्या बाजूनी प्लेस्ड असतो. तुम्ही पाहिलं तर 6 वर्षाच्या मुलाचा जो पहिला दात येतो ना तो खूप पुढे दिसतो. राईट. इट गिव्स प्रोक्लाइन्ड इफेक्ट. राईट. सो हे दिसतं. दॅट टूथ इज व्हल्नरेबल. कारण सगळ्यात पुढे आहे. जबडा लहान मुलाचा आहे पण दात मोठ्या माणसाचा आहे. राईट. सो काहीही करताना ना तो दात पुढे टेकतो. भरपूर गोष्टींना टेकतो. चमच्याला टेकेल, बाटलीला टेकेल. काही खाताना पिताना बऱ्याचदा त्यांना अजून त्या गोष्टीचा अंदाजच आलेला नसतो. त्याच्यावरती जाऊन ते नक्की आदळतं. सो इव्हन पळता पळता सुद्धा ते जाऊन धडकतात. राईट. सो युअर फ्रंट 2 teeth आर vulnerable at the age of 6.
Wow. Interesting. So can clenching or grinding of teeth during a sport impact the performance?
Performance as in?
So maybe their focus or the kind of output that they give. So maybe in speed or any focused attention that has to be given. So if they are grinding their teeth or if they are holding their teeth, clenching their teeth, does that actually affect how they are going to the kind of result that they give?
It is the other way around.
Okay.
An individual clenches his or her teeth during excessive concentration. Right. So the concentration might not affect. Because even when you're writing something and if you are engrossed, you tend to grip your pen super tight.
Actually.
Right?
True.
Because you're thinking there are n number of activities going on.
Correct.
So clenching usually does not deviate your concentration, but it affects your teeth. Your concentration or the end part of your game is never the target here. It is your teeth which take up the load for
True.
it.
And then the kind of life that you will have beyond that.
Yes.
Oh, that is nice.
So if you have observed sports psychologists, they also try to relieve the anxiety so that they do not clench their teeth extra hard. Right? This is, the story goes the other way around.
Correct. Oh, nice. Interesting. So does jaw tension affect neck and shoulder movement? Interesting.
If someone is pulling his or her jaw up during deadlifts, you pull this, over a period of time, it comes like this, right?
Oh, wow.
And then this or this excessive movement affects.
Wow.
So the reason why they say is follow the technique is because they wish to safeguard your anatomy.
Entirely. Oh,
yes.
Nice.
It can affect.
This next question I think we've already taken. I'll just share it with you. How can sports organizations educate parents about dental safety?
Easiest way, empanel all care dental.
Absolutely. True. Yes.
We can help you with the rest.
Yes.
It would be a cakewalk for every academy if they are empaneled with us.
Correct.
We take care of the rest. All they have to do is empanel.
Just absolutely fantastic. And my last question for today is, what emergency steps should parents take if a tooth is knocked out, chipped, or fractured?
Visit the clinic on priority. So let's take it stepwise. Initially was knocked off, right? Like I mentioned before, keep it in a small case with milk. Do not clean or scrub the tooth surface. Just get it to the clinic. The dentist will do the needful, right? Now, if it is chipped, visit the clinic on priority. If the chip part is not involving the pulp of your tooth, we don't need a root canal.
Wow.
If the chipped part involves the nerve of your tooth, then a root canal is mandatory, because once the nerve of your tooth is exposed, we cannot retrieve it to life again.
Right.
It deteriorates forever.
Right.
It's gone for good, right? So a root canal followed by a filling. And if it is a grossly fractured tooth, then a cap or a crown on top of it is a mandate. Then comes about internal fracture lines, right? If there are minor internal fracture lines, at times your dentist will not advise you a treatment for that. But if the fracture line is going to raise concerns, because maybe it is a broader line, it is going to harbor food in those cracks and crevices, then what we do is we usually grind the structure, we widen that gap, and we fill it up with a cement. Nice. So that it does not open further ahead. The crack doesn't open further ahead. Right. And then your tooth is protected. But it is mandatory to visit a dentist if you have had any kind of dental injury associated with spot.
Absolutely. Thank you so very much, Amruta, for so many insightful shares about how we need to take care of our teeth and why it is important in the long run. Thank you so much for joining us here.
Thank you so much for having me here.
Yes, thank you.
And I would suggest every spot individual to please come and share your story with Tanushree. Yes. Trust me, the story she makes for you makes you feel I am on top of this world in my profession.
Oh, wow. Thank you. Thank you so much for that. So guys, yes, I know most of us, like 99% of us, are scared of going to the dentist. But I think the conversation that we've had right now with Dr. Amruta must have, reduced all of these fears for you. So in case you have any sporting injuries when it comes to your dental care, make sure that you reach out to her. We will put down the details of her clinic down in the captions below. There are 4 clinics in Pune city, so you have no excuse not to take care of your teeth anymore. Thank you so much for joining us, and thank you so much for watching.
Thank you, Tanushree. Have a great day.